In parts of rural America, there's an epidemic within the pandemic. Opioid and prescription drug abuse have been ravaging rural states like Kentucky and West Virginia for decades. The CDC says it's a full-blown epidemic being made worse by COVID-19. NBC News correspondent Cal Perry joins us now from Arlington, Virginia, with a closer look at this issue. Cal?
You know, it's really bad across the country. It's actually worse and more acute in places like Kentucky. We've all dealt with things with this pandemic, whether it's loneliness or separation from family or loved ones or maybe economic trouble. The issue is if you're dealing with substance abuse, those issues can quickly lead to a crisis.
Tripped me up was the lady laid me off from work, and the only thing I know was to go back out and get one more.
Were you laid off because of the pandemic?
Yes, I was.
Jimmy Moore has struggled with addiction for 20 years, and the pressures of the pandemic proved too much. He relapsed.
Family members just pulled away because they ain't got jobs either, you know, and it's hard to find any kind of income at all. And addiction has went through the roof. I mean, that's my next best friend, it is. And that's the only thing I know.
Substance abuse has spiked nationally, a silent epidemic inside a pandemic.
The number of calls, especially from young people in crisis, isolated in their homes and feeling the unrest and uncertainty of the future.
From September 2019 to September 2020, drug overdose deaths went up by 29% across the United States. But in Kentucky, the increase was 50%. 7 county services in Louisville helps those struggling with inpatient and outpatient care. These days, they're doing the best they can in a world no longer conducive to human touch.
The normal places that you would meet and gather, say AA meetings or NA meetings, have been turned into virtual meetings. So you may be able to show up on that camera and fake it for a while and maybe then get off that camera and be alone again. We find that the individuals that we serve, when we find them overdose, they're alone.
Rick, who declined to give us his last name, grew up right here in Louisville. An epicenter of the crisis, he tells us he's had a number of friends recently overdose. As a recovering alcoholic himself, he believes in-person contact is essential.
The biggest part for me is like groups, because like we can't do groups unless they're through like Zoom, and it just lacks a certain intimacy that is not there.
And Cal, I know there are a lot of resources out there for people who need help. What do the experts recommend for folks who are trying to find help for themselves or for a loved one?
You know, the big one is this national helpline number. I'll put it on the screen for you now if the control room could do so. I'd appreciate it. 1-800-662-HELP. That's 1-800-662-HELP. This is a line for everybody. Please do use it. Aaron, to give you an idea of sort of how this crisis is continuing and even getting worse, that helpline number saw a 27% increase in callers in just the past year.
All right, Cal Perry for us in Arlington, Virginia. Cal, thank you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.